Hi, my name is Dr. Fred Dery from the Steindler Orthopedic Clinic in Iowa City, Iowa. My area of specialty is interventional pain medicine, and I'm going to be discussing epidural steroid injections with you today. Epidural steroid injections are safe and effective procedures for treating pain from a variety of pain-generating syndromes in the spine, such as disc herniations, spinal stenosis, pinching of the nerves, or sciatica. First, we're going to cover some basic anatomy. The outermost layer of the spinal cord is called the dura. Therefore, the area immediately around the spinal cord is referred to as the epidural space or area around the dura. That is within the spinal canal. Surrounding that is the vertebral bodies, which are the bony structures of the spine. The goal of performing an epidural steroid injection is to safely place a needle into the epidural space and ultimately inject steroid medication to help with inflammation or pain that's coming from discs, pinched nerves, and the like. Here at the Steindler Clinic and at our surgery center down the street, I perform all of the procedures under X-ray or fluoroscopic guidance so that I can make sure that we're in an appropriate anatomic position and safely perform the procedure. In a nutshell, what's going to happen if you have an epidural performed by me is that you'll be laying flat on your belly, and I will clean off the appropriate anatomic target site with some soap and then cover that with some sterile towels. Using the X-ray machine, I'll use a sterile clamp to mark the appropriate anatomic site, and then we'll numb up your tissues, both the skin and the underlying tissues all the way down to the spine. And using the X-ray machine, I will then guide a needle through the numbed up tissue into the epidural space. I'll take a couple more pictures to make sure that we're in an appropriate spot, and then I will inject some contrast dye to make sure that we're not in a blood vessel or any other inappropriate anatomic structure. Once I believe we're in an appropriate and safe spot, I'll be able to inject some steroid, remove the needle, and then address a different level or the opposite side if necessary and appropriate for that particular procedure. Once we're done, we'll clean up your back and apply a Band-Aid to the area so that there's no blood on your clothing, and we'll get you back to the recovery area where you'll sit for anywhere from 10 to 20 minutes to be monitored to make sure that you're feeling okay. As long as you're feeling fine, we'll be able to send you home under the care of a responsible adult. And for the rest of the day of your procedure, we prefer that you not do any strenuous physical activity or operating any type of machinery, including driving. And that's for your own safety. Starting the day after the procedure, you can get back to activity as tolerated, and you'll be following up with your referring physician if that was not me. We generally see that it takes anywhere from 7 to 10 days to get maximal benefit from an injection, and it could take upwards of a second or even third injection within the ensuing following weeks or months to get maximal pain relief overall. So please make sure you follow up with your doctor after your procedure.